This recorded lecture will be going over Chapter 10, the immune and lymphatic systems in the MedSurg textbook. Bone marrow produces a type of stem cell that is able to produce all types of blood cells, including white blood cells, red blood cells, and platelets. They then differentiate into the cells of the hematologic and immune systems. The thymus gland is located behind the breastbone, and it's where T lymphocytes mature and then are released into the bloodstream. Lymph nodes and vessels circulate fluid called lymph. It contains nutrients such as proteins, glucose, monocytes, and lymphocytes. The lymph system removes what is left over after the plasma has delivered nutrients to the cells. Tonsils and adenoids are lymph tissues that guard the airway away from inhaled microbes. The spleen filters blood. This allows lymphocytes to come into contact with any circulating organism and activate the appropriate lymphocyte response. The immune and lymphatic systems work together to guard the body against pathogens and eliminate them if they manage to pass through external barriers. Both humoral and cellular immunity are carried out by lymphocytic cells, a special type of white blood cell that originates in the bone marrow. B lymphocytes migrate to lymphoid tissue, where they will wait in readiness to form either sensitized lymphocytes or antibodies. The lymph system, in addition to facilitating the work of lymphocytes, will also drain tissue fluid and put it back into circulation. Immunity can be acquired actively or passively. Aging will cause the skin to become thin, less elastic, and more prone to injury. The skin is the first barrier encountered by pathogens. Decreased ciliary action in the respiratory system and GI tract will result in decreased removal of potentially harmful organisms. The presence of chronic diseases can decrease the immune response. Some portion of the lymphatic system is found in every part of the body, including our central nervous system. The sensory nervous system will interact with the lymphatic system by helping to alert the body to outside physical threats by relaying chemical signals back to the brain. The hematologic system interacts in the production of specialized white blood cells that help fight infection and rid the body of foreign invaders. The primary job of the immune system is to protect the body from agents that can cause disease. The first line of defense begins with the skin, tears, earwax, mucous membranes, and urinary tract. Innate immunity is present in the body even before exposure to any unknown antigen occurs. The tissue damage created by the invading microorganisms will release certain chemicals within the body. These chemical triggers, such as histamine, will lead to the activation of the inflammatory response. This can then cause blood and lymphatic systems to deliver certain types of white blood cells, lymphocytes, proteins, and other nutrients to the affected area. The first step in the body's defense mechanisms against the invasion is inflammation or the inflammatory response. If the injury is close to the external surface of the body, there will likely be obvious redness and swelling. The area may also be warm and tender to the touch. The delivery of select cells, proteins, and chemicals to the affected area will increase blood flow to the site by circulating blood and lymph vessels upstream of the injury. This results in warmth and redness. The same substances will also affect downstream vessels, causing vasoconstriction and swelling. In the effects that swelling are not quickly controlled, the edema can compress nerve endings and surround the area of injury, leading to a pain reaction. Protective proteins that are activated in the inflammatory response would include the complement system of proteins. The mechanism of the inflammatory response combines with the immune response to eliminate foreign invaders. Immune response activities involve constant surveillance to detect the entry of foreign agents as soon as they gain access to body cells, immediate recognition of the agents as a non-self or foreign, the ability to distinguish one kind of foreign agent from another, and to remember that particular agent if it appears in the body again at a later time. The immune response is usually triggered by the body's identification of something as foreign or non-self. This recognition is essential for the body to respond to a foreign threat in an appropriate manner and to not react to tissues or cells that are typically recognized as self. When an inappropriate response happens, one of two types of disorders is occurring. If there's a lack of an appropriate response, an immune deficiency is present. The second type of disorder occurs when the body produces an immune response to self, cell, or tissue, causing an autoimmune disease or an autoinflammatory disease. Once a foreign substance or antigen has been detected and identified, the body will respond in two general ways. It immediately produces a protein called an antibody that is specifically designed to attack the antigen. Non-living matter such as pollen, dust, and chemicals can also be antigens. Allergies to medications will work by the same mechanism. The immediate response is called a humoral response. Humoral refers to any fluid or semi-fluid. The second kind of response is called a cellular or cell-mediated response. The lymphatic T and B cells interact with each other in complex ways. Both T and B cells are necessary for an immune response to occur. Lymphocytic B cells are involved in humoral immunity and the production of antibodies. When stimulated by an antigen, a B cell becomes a plasma cell that secretes antibody molecules into the bloodstream. These are also known as immune globulins. The immune globulins are secreted by the B cells. These are specific to the antigen that they will encounter. There are 5 classes of immune globulins. This includes IgA, IgD, IgE, IgG, and IgM. This is antibody-mediated immunity, or humoral immunity. Some of the antigen-stimulated B cells will become memory cells. This mechanism is the basis for our acquired immunity. The memory cells will reactivate the plasma cells to produce large quantities of that specific type of antibody needed to fight a particular type of antigen when the antigen enters the body for a second time. It is an immediate and potent response, and antibodies will continue to be produced for many months. These antibodies are called immunoglobulins. An antibody can either destroy or inactivate its particular antigen by mechanically harming it, activating a complement system, or causing the release of chemicals that affect the environment of the antigen. Through a process called lysis, the antibody prepares the antigen for ingestion by damaging the outer membrane of the antigen cell. The damaged cell then ruptures, making its contents accessible for digestion by phagocytes. If the antigen is a toxin or a poison produced by a bacterial or viral cell, the antibody produced to fight it will be called an antitoxin. An antitoxin is therefore a specific type of antibody that acts through the process of neutralization. To summarize this process, when a bacterium or other agent enters the body, it may encounter a B lymphocyte that is specific for the bacterium or antigen. The B lymphocyte will become a plasma cell that secretes IgM. This then attacks the bacterium or antigen. After the particular bacterium or antigen is encountered for the first time, it will take 4 to 8 days for the B lymphocyte to produce immune globulins that can attack. If the same bacterium or antigen enters the body again several months or even years later, the immune globulin response by the memory cells will be much quicker, and the invading cells will be attacked much sooner, typically 1 to 2 days after a re-exposure. B lymphocytes can produce either sensitized lymphocytes or antibodies. The antigen-antibody response is also involved in allergic and transfusion reactions. The second type of immunologic response of the body involves various interactions with antigens by T lymphocytes. Unlike the humoral response, which takes place in the plasma, the cellular response involves whole cells called sensitized lymphocytes and will occurs out in the tissues. They are said to be sensitized because they have been made sensitive to a specific antigen after their first contact with it. Subsequent exposure to that antigen to which they are sensitive will trigger a host of chemical and mechanical activities, These are all designed to either destroy or inactivate the offending antigen. T cells can provide defense against viral infections. Host cells containing the virus have small fragments of the virus slightly protruding from their cell membrane. The T cells will identify this virus fragment as foreign and then kill the host cell. T cells and macrophages produce a variety of substances called lymphokines. These help destroy antigens. Killer T cells attach themselves to cells bearing antigens and then secrete toxic substances that kill the antigen-bearing cells. This cell-to-cell contact response is called cell-mediated immunity or cellular immunity. These specific T lymphocytes will enter the circulating fluids of the body from the lymphoid tissues. They will migrate widely and react anywhere in the body where they encounter that particular antigen. Destruction of the antigen can occur by release of chemicals into the membrane of the target cell, by secretion of lymphokines such as interleukin-2 or T cell growth factor, or by other processes. This direct contact by the T lymphocytes with an antigen is called killer activity, and such lymphocytes are named killer T cells. The complement system of proteins is a series of proteins produced in the liver that works with antibodies to destroy antigens. Similar to the inflammatory response, the complement system directly kills microbes by attaching to the cell wall and allowing salt and water into the cell. This causes it to burst. The proteins of this symptom will complement or assist the immune system. The T lymphocytes perform immune surveillance for the body by detecting cells that enter the host and have foreign antigens on their surface. Sensitized T lymphocytes are the cause of allergic reactions. Autoimmunity means that there is a defective cellular immune response, and antibodies are produced against normal parts of a person's body. These T lymphocytes, along with migrating macrophages, are responsible for rejecting transplanted organs as well. There are two major types of immunity to specific disease: innate or natural immunity and acquired or adaptive immunity. Innate immunity is present at birth. Acquired immunity occurs through active production of antibodies when the body is invaded by pathogens or through an immunization that causes antibodies to a specific pathogen to form. Unique innate or inborn features of human cells will make a person naturally immune to certain diseases. Humans are immune to some diseases simply by being human and are not susceptible to the same diseases as animals of other species. Genetic factors present at birth can also predispose individuals to immune disorders. In acquired immunity, a person can either actively produce their own antibodies or they passively receive antibodies produced by another person or animal. This is known as passive immunity. Passive natural immunity is the type that is transferred from mother to baby. The mother passes antibodies to the fetus in utero or after birth through breast milk. When the fetus is in utero, it passively receives some natural immunity when antibodies from the mother's bloodstream will pass through the placenta and mix with the blood of the fetus. These maternal antibodies are then present in the infant's blood at birth. More immunity can be passed to the infant through breast milk. Breastfeeding is the best way to protect the newborn from infectious disease. Administration of human immune globulin to boost the immune system is an example of passive artificial immunity. This type of immune globulin is used when an individual has a humoral immunodeficiency. Their body does not produce enough antibodies, or there's an autoimmune destruction of platelets, red blood cells, or nervous system tissues. The blood serum from a horse that has been prepared with an injection of venom antigen contains ready-made antibodies and antitoxins against an antigen. This is how we produce snake antivenom. Tetanus vaccines are made from inactivated tetanus toxin. Substances that provide passive immunity should be given as early as possible in the disease because they will only protect against further tissue damage. It is important to note that immune globulins, regardless of the source, will not reverse damage already done. Active naturally acquired immunity occurs when a person contracts and survives a disease. Once survival from a disease has occurred, the person is considered immune and will not contract that particular disease again. Active artificially acquired immunity occurs by vaccination or immunization. To provide active immunity to diseases by artificial means, The actual pathogenic microorganisms are grown and cultured in the laboratory. They are divided into single doses under rigid controls and then made into vaccines. These specially treated microorganisms are weakened or killed so that they can stimulate the production of antibodies but will not actually cause the disease itself. Vaccines from cowpox, tetanus, influenza, measles, mumps, chickenpox, hepatitis A and B viruses are examples of immunizing agents that are used to produce an active immunity in humans. This immunity does not last indefinitely. The body needs to be reminded of the need to produce more antibodies. To achieve this, a booster dose of the immunizing agent can be given to boost the memory of the specific B cells and then cause them to actively produce more antibodies. One of the more commonly encountered reasons for alteration in immune function not caused by pathogenic factors is called iatrogenic. This is a condition caused by medical treatment. Many over-the-counter medications have anti-inflammatory effects and can be used to decrease pain caused by inflammation. The inflammation is the initiation of the immune process. Suppression of this response can hinder the body's ability to fight infection or disease. Consumption of alcohol can alter the body's ability to launch an immune response. There are both long-term and short-term effects of alcohol on the immune system. 2 drinks can impair the ability of the B lymphocytes to produce antibodies and can affect T cell activity. Long-term alcohol use will lead to alteration in liver function and impaired nutrition. They can also alter your immune function. Many other drugs, including cocaine, marijuana, and methamphetamines, will also compromise the immune system. Autoimmune disorders are caused by a malfunction of the body's immune system. When the body does not recognize the tissues as self, defense mechanisms are launched against the body's own tissues. The trigger for this attack is largely unknown. However, some of these disorders are believed to be initiated by a systemic infectious process or by inherited factors that are still not fully understood. A good example of this would be rheumatoid arthritis. On page 210, take a look at the green health promotion box about maintaining a healthy immune system. A healthy immune system is a function of a healthy body. Eating right and getting enough rest and exercise are all important in maintaining resistance to infection and disease. Frequently skipping meals, eating unhealthy meals, sleeping too little, or not exercising will weaken the immune system and make people more susceptible to pathogens. Today, immunity from immunizations is typically achieved by administering the vaccine in divided doses over weeks or months. The Centers for Disease Control and Prevention recommend that adults receive the Tdap vaccine, which will help fight against tetanus, diphtheria, and pertussis every 10 years to stimulate continued immunity. Nurses play a major role in providing education regarding the importance of immunizations. Vaccine-preventable diseases cause disabilities and deaths every year. Patients with respiratory disorders should be encouraged to get the influenza vaccine. A goal of Healthy People 2030 is to reduce, eliminate, or maintain cases of vaccine-preventable diseases. An important aspect of health teaching is to improve the general public's awareness of the importance of immunization as a means of preventing certain diseases and their consequences. Nurses have a responsibility to inform the public about the purpose and importance of immunization in terms that the lay person can understand. Parents should be told why immunization is important for their children and to be warned of the dangers faced by children who are not adequately immunized. This information must be presented in such a way that parents do not feel threatened or badgered. Older adults and others who are particularly susceptible to influenza and pneumococcal pneumonia should also be immunized according to recommendations by public health officials. Healthcare workers should be immunized annually for influenza so that they don't transmit the disease to susceptible patient populations. The CDC has recommended immunization schedules for people of all ages, including those who have never been vaccinated. The Joint Commission and Centers for Medicare and Medicaid Services have collaborated on standards that require all inpatients to be offered flu and pneumonia vaccinations as appropriate prior to discharge. Circumstances that require modifying or postponing immunization would include fevers, immune deficiency disease, immunosuppressive therapy, and administration of human immune globulin or plasma. Whenever an immunizing agent is to be administered, precautions must be taken to ensure, as much as possible, that the patient is not hypersensitive to the components of the agent. Religious orientation is also important to consider because some vaccine products are made using human blood products or pork or bovine material. These can be strictly forbidden by certain religious tenets. Federal law requires that a vaccine information statement prepared by the CDC be provided to anyone receiving a certain vaccination. It is imperative that a history of allergies in the patient and family be obtained before administering an immunizing agent. It should also be determined whether the patient has an immune deficiency disorder of any kind that would prevent any normal immune response to the immunizing agent. If the patient has had an allergic reaction to the specific agent that they are supposed to receive, the vaccine should not be given. Skin testing for sensitivity should not be confused with skin testing for diagnostic purposes. Testing for sensitivity is performed to determine whether a minute amount of the immunizing agent will produce a local reaction. Botulism antitoxin is an example of a treatment for which a scratch test is mandated before administration. To avoid serious problems, always be prepared to act quickly and effectively in such an emergency. In all patient care areas where immunizing agents are administered, emergency equipment must be readily available. As an extra precaution to ensure prompt treatment for a hypersensitivity reaction, it is advisable for people receiving immunizing agents to remain in the clinic or office for 15 to 20 minutes after an injection is given. Keeping the body healthy is the best way to preserve immune function. Not smoking, staying physically active, getting adequate rest, and eating a balanced diet are all measures that need to be encouraged. Because of the function of the immune system is to guard the body against microbial invasion, it is important to assess the patient for signs and symptoms of infection. These would include fever, redness, swelling, and exudate from an open skin area. Another indicator of a depressed or inadequate immune response would be recurrent infections or infections to a common organism to which individuals with a normal immune system would not be susceptible. A thorough history must be gathered. The patient should be questioned about any recent surgeries, blood transfusions, and diagnoses of chronic illnesses. Information regarding smoking history and exposure to environmental and industrial radiation or pollutants should be obtained. It is important to do a thorough physical assessment of the skin to identify any potential entryways for organisms. Remember to assess those areas where catheters, tubes, and other medical devices may penetrate the skin barrier. When the immune response is activated, lymph nodes may become swollen and tender and can be evaluated by palpation. Nodes in the neck, axilla, and groin are those most commonly examined because they are closer to the skin surface. Data obtained from a head-to-toe physical assessment will provide important information regarding immune and lymphatic system function. Skin testing is one of the most commonly used techniques to measure immunity and to identify people who may have a dormant infectious disease. A scratch test, also known as a prick or puncture test, would involve dropping extracts of allergens into scratches made onto the skin. Intradermal injection of allergens is used to detect allergies to insect venom or penicillin. Patches containing allergens that may cause contact dermatitis can be placed in direct contact with the skin. Inflammation and itching will identify allergens that provoke the immune system. A CBC will give information regarding the number of circulating white blood cells. An increased number of white blood cells would indicate that the immune system is activated. A chemistry panel can be done to rule out any other causes of signs and symptoms. C-reactive protein should be measured to identify inflammation. Most imaging is done for research purposes. Computed tomography, MRI, and PET scans can all be used to evaluate the thymus glands and other tissue structures of the immune system. Nursing interventions would include all methods to prevent the spread of infection. Promotion of balanced, adequate nutrition is essential in maintaining or regaining optimal immune function. Psychosocial care to decrease fear, help deal with lifestyle or role changes, and reduce stress is important in caring for the whole person. Patient teaching regarding the disorder, treatment, signs of complications, and self-care is an effective way to reduce a patient's stress and fear. Evaluation would include gathering physical data as well as monitoring laboratory and diagnostic study results for improvement. Temperature and other vital signs are also good indicators of immune function. A rise in body temperature will typically signal a normal immune response to infection. There is a significant amount of evidence-based research that shows that a fever is helpful to the immune system. Hyperthermia or fever-related infections can cause discomfort, and an excessive fever can lead to complications such as seizures. Excessive fear is usually treated with antipyretics and cooling measures. Excessive fever. Cooling measures can be as simple as removing excess coverings or as complex as using mechanical cooling blankets and cooled IV fluids. Cold water is contraindicated because rapid cooling can induce shivering, and that can then drive the temperature back up. The ideal treatment for a fever is to address the cause. Anorexia will often accompany fever, infection, and the use of antimicrobial agents. Increased body temperature will cause an increased metabolic rate. This will increase cellular metabolism using more oxygen and water than under normal circumstances. Offer the patient favorited foods and fluids in small portions that can sometimes tempt their appetite. Patients can be immunosuppressed, either from the disease process or from their medical treatment. Patients who must take daily corticosteroids for any reason, such as those with chronic asthma, post-organ transplantation patients, or patients receiving chemotherapy, are immunosuppressed. Hospital settings are known for having a high concentration of pathogens simply due to the variety of patient illnesses. It is critical within the hospital environment that all standard infection prevention and control protocols be implemented and followed by everyone without fail. Patients with neutropenia may need additional precautions. Protective isolation precautions would refer to procedures that may be implemented to protect immunosuppressed patients from exposure to other infectious microorganisms. Preventing the transmission of potentially infectious microorganisms to any patient, regardless of their immune status, is the principle and the goal. The degree to which these measures are implemented will be determined by the degree of immunosuppression. Any patient who is ill and hospitalized has an immune system that is under stress.